Looking at our next type of microbiologic test is our culture. And there's lots of different types of cultures, but the purpose of a culture is to grow out bacteria to help identify it. And you also isolate bacteria or separate bacteria on a medium, a cultured medium. There's lots of different types of media. You can have a liquid media, which allows for diffuse growth, growing in some type of broth, media broth, or a solid media where you can see distinct colonies. When we think about when a culture might be indicated, this could be if we had STI concerns or to try to detect the specific bacteria involved, to diagnose infections of anywhere in the body, blood, gastrointestinal, genitourinary, upper or lower respiratory tract, diagnosing active TB, you can culture out, evaluating or treating infections of wounds or soft tissue infections. And because once you have a culture, you can also determine antibiotic sensitivity. When obtaining a culture, regardless of location, you want to get a sample prior to initiating any antibiotics or any antimicrobials. Because if you don't, that could hinder or halt your results. You want to make sure you explain the procedure to the patient, follow universal precautions to protect yourself, collect the culture via the lab requirements, and label it fully. Name of patient, date and time collection, and source or site of specimen. Looking at kind of our easiest one, what we've kind of already been talking about, urinary tract culturing. The resident flora of the urinary tract, that really should be sterile above the urethra. Urine should not have any bacteria in it. The distal portion of the urethra is colonized, and then you'll find similar organisms as found in the genital tracts. The resident flora then of the genital tract are a mixture of lactobacilli, alpha hemolytic strep, diphtheroids, Gardnerella vaginalis, as well as yeast. When you're obtaining a clean or a urine culture, you want to do a clean catch midstream sample because this avoids contamination from skin and genital tracts. You then transfer urine to the tube with preservative to prevent bacterial multiplication after you get your sample. And the lab then will process and report a colony count of isolated organisms. E. coli is the most common urinary tract pathogen, but you can see Klebsiella or other Enterobacteriaceae or even Staph saprophyticus. Some hospital-acquired infections that are different than the ones listed above include Pseudomonas, Enterococci, and Staphylococci species. When we come back, we'll look at throat cultures and their indications.